story of our community members who are going to work, but they're still struggling to survive. This report covers every county and every municipality in the state of Pennsylvania. The first ALICE report was released in June of 2019, and since then, United Way of Franklin County has been across the community to tell the story of ALICE in our communities. At the end of January of this year, United Ways across Pennsylvania released the 2020 ALICE report refresh. So this had updated data, the most recent data available, which is based on the 2018 total population data. This is because the methodology that's used, the most complete point in time data that we can use, it will always be 2 years prior. So I aim today to help all of you better understand the challenges that are facing working households that are struggling to meet their needs. My hope is that this ALICE data can help advocates like yourselves identify the most vulnerable in our community and help direct programming and resources to assist them on their path to financial stability. So I will start by sharing part of a video that gives a really great overview. Now, bear with me as it loads. And I'll actually reconfigure my screen share. Tech transitions, always fun. Okay. Let me share again. Okay.
Meet Alice. It's the senior couple who lives across the street, the child care worker who looks after your children while you're at work, the bank teller you chat with during your lunch break, the teacher who got your child interested in reading, and the 24-year-old nursing assistant who is helping to save lives every day. ALICE stands for Asset Limited, Income Constrained Employed, and is an acronym for the 1.3 million Pennsylvania households who earn an income higher than the federal poverty level, but less than what they need to afford basic living expenses. 12% of Pennsylvania households live below the federal poverty level, and another 27% are ALICE households. That's roughly 1 in every 4. These two groups amount to 39% of Pennsylvania's population, and every day they struggle to make ends meet. ALICE are proud, hardworking Pennsylvanians who pay taxes and are vital to our economy. They typically hold jobs that build and repair our infrastructure and educate and care for the general workforce. Many ALICE workers even have multiple jobs. But despite their hard work, ALICE struggles to pay their bills each month. ALICE has little or nothing in savings, and they are forced to make tough choices, like paying for quality childcare or paying their rent. A single working adult in Pennsylvania needs to make about $11.77 an hour, or roughly $23,544 a year, to afford all household essentials. A family of 4, which includes 1 infant and 1 preschooler, needs to be making a combined income of about $34.82 an hour, or $69,648 a year, in order to afford all household essentials. 32% of Pennsylvania families with children fall below this threshold. 58% of jobs in Pennsylvania pay less than $20 an hour, with almost half paying between $10 and $15 per hour. All the while, basic living expenses continue to rise. Over the past 10 years, Pennsylvania's bare minimum household survival budget has increased by 39% for a single adult and 46% for a family of 4. Because of these factors, the life that ALICE leads is volatile. ALICE's income tends to ebb and flow throughout the year, with some months being more financially stable than others. At any given time, ALICE households are only one emergency away from falling into poverty and needing some form of public assistance. This means that a car repair, a layoff, an unexpected medical bill, or having to miss a few days of work to take care of a sick family member could completely derail Alice's financial stability. Can you imagine the stress of living on the cusp of such financial insecurity? There are many who carry that stress every day. Alice lives across Pennsylvania, in every county and every town, and can be found in every age group. If you are not Alice, you probably know people who are. Alice is essential to Pennsylvania's economy because they are the people that make it possible for so many Pennsylvanians to do what they do on a regular basis. That's why United
Okay, let me reshare my screen, not optimized for video. And then I'll continue with the presentation. Okay, so that video, I'll share my video again too. I really like that because it's a really great overview of who Alice is in a relatively short amount of time. So I'll just kind of review some of the highlights again. The video shared what Alice stands for. So Alice, we know, holds low-wage jobs. They earn above the federal poverty level, but below the household survival budget. And they have no savings for emergencies or investing in their future. So in a nutshell, Alice households cannot afford their basic needs, from transportation, childcare, healthcare, food, and housing. This means they have to choose between paying for these essentials month to month. Before I go any further, is somebody saying something?
Yes, I just wanted to let you know we're seeing your notes screen, yeah, so the actual main slide is a little smaller than you probably mean it to be.
Thank you, Kim.
I wanted to catch you early.
I got 3 screens here I'm working with, so
no worries.
Is that better?
Yes, there we go. Okay. Thanks so much.
Thank you. Okay, so let me talk about some of the key terms then. So first we'll talk about, oh great, now I gotta click. Okay, Alice, as we've been talking about, those are the households that have an income that are above the federal poverty level, but below the basic cost of living, that household survival budget. Poverty are households that earn below the federal poverty level. The Alice threshold is when we talk about the Alice threshold, we're talking about the average income that's needed for a household to meet their basic household survival budget. So I'm going to talk about throughout the presentation people below the Alice threshold and then people above the Alice threshold. And that threshold is based on the household survival budget. So this outlines the bare minimum costs for basic necessities from the housing, childcare, food, transportation, health, and technology. So let's look at Alice in Franklin County. In Franklin County, 33% of our households cannot afford their basic needs. They are below that Alice threshold. Of this, 11% live below the federal poverty level, and the other 22% are Alice. So this means that of our 59,000 something total households, 13,375 of them are Alice, and 6,651 are poverty. From the Alice report, one thing we know about those in the Alice area is that they are working households. So they are employed and working in our communities, but do not earn enough to support their household needs. Now let's take a quick step back and see how Franklin County holds up compared to the rest of the state. When you look at the map, the lighter blue counties have less Alice and poverty households, and the darker blue ones have more. So you'll notice Franklin County is actually a fairly light shade of blue. There are just a handful of counties that are, if you could say, have lower amounts of Alice and poverty than Franklin County. Those would be Chester is the best off at 27%. Bucks and Montgomery both have 30%. and York has 32%. And then the ones that have 33% the same as us are Butler and Cumberland counties. But when we look at breaking down that below the ALICE threshold number into which are ALICE and which are poverty, you may notice that Franklin County actually has the highest percent of poverty level out of all of these at 11%. And aside from Chester County, we have the lowest percent of ALICE households. I actually just realized this difference when I was working on this presentation. And so I've been thinking about why that might be. And I don't have any statistical data at this point. I'd like to dig in the data more to look at why that is. But we can see that the gap is growing between those who are not able to make their needs and are becoming worse off versus those that then are being raised up to be able to support their needs. So I'd be interested if any of you have any theories when we get to the discussion part on why that might be. Now, taking a look at the breakdown of Franklin County by municipalities, you can see that the map, there's the variations in the color shade between the boroughs and townships. When we look at the highest percentage that are below the ALICE threshold, we've got Waynesboro Borough at 53%. So that's over half of Waynesboro Borough households cannot meet their needs month to month. Then Chambersburg Borough is at 46, so nearly half, and Meadow Township is not far behind at 45%. Then we look at the areas that have the lowest percent that are below the ALICE threshold. So they have higher households that are above ALICE and able to meet their household needs. We've got Mont Alto Borough at 19%, the lowest, and then followed by Warren Township, 22%, and both Montgomery and Antrim Township have 24%. Now I know through some community conversations we've had before about ALICE and Franklin County that people have shared how the boroughs are higher, could be higher concentrated because there's more rental availabilities, they have closer access to services. And in terms of Meadow Township really being a rural area, that they are further away from services, access to services to be able to help assist them. So those could all be factors that are playing into these numbers. So we've looked into where ALICE lives. Now let's dive into the methodology behind the report and what classifies whether a household is ALICE. The ALICE report identifies what is called the household survival budget. And this survival budget is truly just the essentials. It'll be on the screen there before you. This includes no money for cable, no money for going out to movies or to dinner. Hopefully your car doesn't break down or the refrigerator doesn't stop working. The ALICE survival budget really has no room for error or emergency. All it takes is one unexpected emergency on any scope to push this delicate budget out of balance. The survival budget also takes into consideration the makeup of a household. So it takes into consideration the number of people in the household and the age of the people in that household. So let's take a look at an example of one of these budgets. I'm going to talk about a 4-person household that would have 2 adults, 1 infant, and 1 preschooler. So this would mean 2 children would need childcare. When we look at the housing, we're looking at $901. That's based on HUD fair market rent, and that would include rent plus utilities. If anybody in this group has any familiarity or has looked for rentals in the area, I think you would be hard pressed to find something for a family of 4 for $900 that included utilities in that as well. So even that to me seems a little low, but that is based on the HUD fair market rent. Then we'll look at childcare, and that would be higher than the rents, which that is a trend that we see, that childcare often competes with the fees for renting. And that's based on the cost of certified childcare homes. So this would be in-home childcare provided because they are typically less than centers, but it would be a certified childcare home, not just a neighbor that is doing it unofficially. Then we're looking at the food budget, which would be 786, and that's based on the thrifty level of USDA food plans. And again, in that plan, they try to account for nutrition, but what we know from doing this work in community is that when you have less money to spend, you're more likely to spend it on processed, unhealthy foods, and to help try and save money, because healthier food is typically more expensive. Then when you look at transportation, because we live in an area that has no public transportation, this is accounting for 2 cars for this 2-adult household. And that's looking at state level car costs, as well as the minimum insurance that's required, and budget for gas, oil, and regular vehicle maintenance. And that's just regular maintenance. That doesn't include anything unexpected that might break down. Then we look at healthcare, and that includes health insurance premiums and an average of out-of-pocket costs. This one can be the hardest one to try and budget for when we're looking at this, because there's such a wide variety of what health and coverage could be covered, and also what individuals and households' healthcare needs are. So then we go to technology. And as I kind of mentioned before, this doesn't include cable. This doesn't even include internet access. All this includes is the cheapest available smartphone plan by Consumer Reports. And this is because cell phones have really become essential to be able to work in the United States. Trying to be employed and not having quick access for your employer to be able to contact you, or you to be able to contact your employer, has proven more and more difficult as time goes on, especially as we've seen through COVID, I believe. Then the miscellaneous budget, which for this family would be $503, that just includes 10% of the budget total. This would have to include everything else that's not covered in that. So that's got to be clothing, it's got to be diapers, it's got to be cleaning supplies, any gifts that may come up. Everything else has to be filed under this miscellaneous. And then it includes taxes, because of course we know every household pays taxes. It includes the federal and state income taxes, as well as their payroll taxes and local taxes. The real estate taxes are not included in this, because those would be included in the cost of rental housing, because Alice doesn't own home or assets. So you may be asking how hard it is to get a job that earns enough to support a household. Well, in 2018, the median hourly wage for the most common occupation, which is retail sales in Pennsylvania, was just $11.08 per hour, or $22,160 if they were full-time year-round. This isn't enough to support any of the survival budgets. It's almost enough for the single adult, but not for any of them. So for this family of 4 that we've been looking into, they would need to earn annually $66,432. That comes to $33.22 per hour. Now that could be either both adults are working in the household, or just one. If one adult is working, they would need to earn that much to come in. Now I like to reiterate, after I go over the household survival budget, that this is the basic survival budget. And when we're talking about Alice and poverty households, they do not earn even this much. Those above the Alice threshold do earn this much, but I think what we can see is that it's a very tight budget and it has no wiggle room, and even just meeting this budget is difficult enough. So 33% don't even earn this much to support their household. Now, let's take a moment to talk about what types of households are struggling. In the past few decades, there have been major shifts in household composition. Adults who have never been married is at a historic high, as is the number of senior households. There's also a growing number of people who live alone or with roommates, and an increasing share of grown children who live with their parents. Yet what we know is that all households continue to struggle. Alice and poverty level households exist across all of these living arrangements. So looking at this graph, you see singular cohabitating as one column, you see families with children as another, and you see 65 and over as the third, and then the final is the total households altogether. So you may notice that of senior households in Franklin County, 44% of them are below the ALICE threshold. This is more than the overall. The ALICE report, like I said, takes into consideration the different ages and number of people in each household. It also adjusts to compensate for the behaviors and spending habits of seniors, who typically spend less on food and transportation and more on health needs and out-of-pocket healthcare expenses. The hourly wage to support the senior survival budget for a single adult was $12.55 in 2018. That is $1.44 more in the hourly wage than that of a single adult. So seniors, if they are still needing to work, they have to actually earn more to support their household than a single adult under 65. So what does this ALICE data help us to tell? It helps to tell the true number of households that are struggling to survive that the federal poverty level just does not accurately capture. So between 2007 and 2018, Pennsylvania's bare minimum household survival budget increased 39% for single adults and 46% for a family of 4. For a single adult, the federal poverty level was $12,140 per year. That's in 2018. But the household survival budget was $22,224. So that's over $10,000 more than what the federal poverty level captures. For this 4-person family, the federal poverty level is $25,100 in 2018, but the household survival budget is $66,432, with including the infant and a 4-year-old. So that is more than double of what the federal poverty level captures. So that is a major point with the ALICE report that it helps us to articulate. It provides a data framework that we can describe a more realistic picture of the true cost for individuals and families. Based on their household makeup, 33% of our neighbors don't earn enough to make this bare bones basic survival budget. And yet, most don't qualify for assistance because of how low the federal poverty guidelines are. And that's even still taking into consideration how many programs may accept 150% at the federal poverty, or sometimes 200% of the federal poverty. It still will not capture all of our households that are truly struggling to survive. And we know that at least 22% of our neighbors, defined as ALICE, are working. They're providing vital services and work that our community, that our economy relies on. They represent childcare workers, or nurses, food service, laborers, bank tellers, administrative professionals, customer service specialists, so much more. But the amazing thing about it is not only does ALICE work hard in critical jobs that support our economy, but they are so generous. While they struggle to meet their own needs month to month, they are so giving of their time and even their money that they really don't have to spare to help others. And we've seen this through United Way time and time again through people that we connect with our organization, is that while they may need help themselves, they recognize that other people still have it harder than them and are struggling more than they do, and they want to pay it forward. So how can you be part of the solution? Because this isn't going to be done just by one organization or one group doing something. You know, everybody will need to come together and work on things. So community actions that we can do is we can advocate. On my next slide, I'll go over some of our advocacy kind of legislative agenda. But if there's a certain cause that really speaks to you, like, advocate for it, speak up. You can contact your elected officials and advocate and let them know what issues are important to you. And you can also look and see what, maybe if your elected official might not be covering a topic, you can see if other elected officials in Pennsylvania or in the region are addressing something. The next thing would be volunteer. Help these nonprofits that are working to serve ALICE households and help provide that time and your talents to be able to support the work that they're doing to help them increase the number of people that they can serve. you can go to our website, uwfcpa.org/volunteer. We have a list of item donation and volunteer needs that our local nonprofits have shared with us, but there's so many more needs other than even just what we have listed. So we work to send out regular updates to people interested in volunteering about what kind of opportunities are out there. So you can get plugged in through us or any nonprofit you reach out to. And then give too. Like I mentioned, giving through community is a lot, or can really help to bolster programs that nonprofits do beyond what the limitations of just any grant funding they might receive enables them to do. So these are the legislative priorities that I mentioned related to the ALICE report. So through United Way of Franklin County, and we really work with United Way of Pennsylvania, the state United Way, to help advocate on our behalf and let us know, keep us updated on what's going on at the state level, as well as the national level, but primarily state. So we want ALICE to really be lifted up and have policy solutions. They need policy solutions, right? It can't all come just from community. We also need policy in place that will help lift ALICE and families up. So we advocate for an investment in Pennsylvania 211, which is the Human Resources Referral Network. That's 24/7 they could call. There's a website they can also text to receive referrals to the programs in our area that can serve whatever their needs are. Then advocating for workforce development that works for ALICE. So yes, this would be job training to help for skilled jobs, but it's more than that. It's helping of overcoming barriers to employment beyond just training. We're looking at accessible and affordable childcare and pre-K. As we mentioned, really the first 0 to 5 years are so critical in ensuring a child's readiness. And if you can invest in those first 5 years, you will be paying less for them later on because they will be starting out ready to go and will be less likely in needs of other services later on, such as potentially being incarcerated or those kinds of things. Also focusing on the well-being of families prenatal to age 3. And this is because the health of young families is really important. And again, if you get families and young children invested in looking at their health early on, it is they're more likely to be healthy later in life and have less healthcare needs then. And then of course, looking at supporting households through COVID-19 and the recovery afterwards. So continuing to have resources through the government, the state and the national level that are supporting households as we move through the pandemic, and hopefully the pandemic will not be affecting us so much soon. But that support needs to happen for families, especially those who may not have been able to return to the workforce because they need to care for somebody at home. They have virtual learning that they need to watch children. There's a lot of reasons that people haven't been able to return to the workforce yet. And so being able to support those families to build them so that they can return to the workforce is really important. So these are some business actions that we can take as employers. I think it's also really important to recognize that we likely employ ALICE, right? And we have ALICE employees that work for us. And so what can we do to build supports around them to provide flexibility and benefits and resources that will help them to move forward? That can be policies and support such as flexible hours, making sure there's safety measures in place, work from home support. There are stronger employee benefits to explore, such as maintaining health insurance, paid and unpaid sick leave. And this was specifically talking about, especially through COVID, some of the things that businesses could do, making sure that paid and unpaid sick leave is there. And then contributing to local organizations from the business level, because business participation in this work is really important too. Not just through funds, but through encouraging your employees to volunteer and get involved, and being really creative about how, as an employer, maybe within your workforce, you can look at programs or partnering with local organizations to help meet their needs. Like there's employers who have started food banks for their employees within the workforce. There's employers like, I don't know of many locally, but like Sheets, for example, is one big one. They have they have their own child care center on site for their employees at their main headquarters. So there's a lot of kind of creative ways that employers can and should start thinking about how they can support their workforce with some of these needs. If you have any follow-up questions from anything I've talked about today, the Alice report, please feel free to reach out. My contact information is on the screen.